I'm Mike Curtin with DC Central Kitchen. We are a nonprofit agency here in DC. We've been around 23 years. We do a lot of different things. One of the things that people most know us for is the fact that we do every day in this city 5,000 meals that we prepare mostly using reclaimed surplus food that was going to be thrown away, that we send out to the city's homeless shelters, transitional homes, halfway houses, and a whole host of other social service agencies. More important than that, however, is the Culinary Job Training program we run, teaching men and women, predominantly those coming out of prison in recovery from addiction, to help them find jobs in the hospitality field or employ them at our kitchen or in one of the many social enterprise programs that we run. So in many ways, sort of putting aside the social enterprise for a moment, I think it's fair to say that a couple years ago, it would be odd for DC Central Kitchen to be in this room, to be talking to this group of folks. But because of some of the initiatives we've taken over the last few years, I think we have really shown, and to continue to show on a very grassroots level, the impact that nonprofits, small nonprofits, social service nonprofits can have using social enterprise when focusing on local food, health, and nutrition. So a couple of those things that we've done, and I have to say this started a few years ago out of enlightened self-interest when we went through a series of negotiations with the District of Columbia that culminated in doing one of the silliest things I've ever done, which was an 8-day hunger strike to convince the District of Columbia that they indeed had a stake in serving the marginalized members of their community. And we got what we were asking for. And that was half of what it cost us to do half of the meals that we do. So we were just asking for a little help in this. And we got it. We embarrassed the district into doing what we believed was the right thing. And I was proud and righteous. And there was a day that I looked at this cart of tomatoes that we had purchased, now with this money that we were getting from the District of Columbia. And I said, man, how cool are we? We're getting this fresh fruit, these fresh vegetables into the shelters, into these people that are medically vulnerable and compromised. And then I realized, after doing a little thinking, that these tomatoes literally came from Belgium. That these tomatoes had been grown in a hothouse, gassed in a plane over the Atlantic, landed in an airport, went into a trailer, to a warehouse, to a trailer, to a warehouse, to a trailer, to a warehouse, to a trailer, to us. And I said, we said, there's got to be a better way. So we started going out to local farms and growers and saying, hey, let us buy. Again, we shifted this nonprofit mentality to a business focus and said, what if we buy from you what you're not able to sell, mostly for aesthetic or geometric and sometimes distribution reasons. But what if we put money back into your community? What if we help make you whole so you can run your business more effectively? And then we can take this food and put it into these 5,000 meals that we do every day. Well, as I'm sure you can imagine, the farmers are falling all over themselves to be part of this. And this was just the beginning of what has now developed into a $4.5 million social enterprise machine that we run every year out of DC Central Kitchen. We started by putting this food into our catering operation. We then moved to doing school food. And right now, I am really, really proud to say that I know we do locally sourced, scratch-cooked food in 7 DC public schools, 1 other private school for at-risk middle school boys. But all 8 of those schools are 8 of the 2,000 that are exceeding the Institute of Medicine standards right now today in the District of Columbia. And while we're doing that, we've created over 50 jobs, most of which are held by men and women that have graduated from our training program. Men and women that would cost us all a lot of money. And we can do that in the basement of the shabby shelter down the street from here. Everyone else can do it too, and can probably do it even better than we can. But I want to say that, when I'm sitting here listening to the last panel, I would argue, or not challenge, what Judith said was amazing about the triple bottom line. But to be honest, I think that's barely scratching the surface of what we're talking about here. Triple bottom line is good, but it's not great and it's not going to get us farther. We need to look at all these other numbers, all the other touch points that we have the opportunities to hit when we're running programs like this. And again, we're doing this at the kitchen to show what's possible. You know, Michelle and his group are doing amazing things on a far greater scale than we'll probably ever get to. But what we want to do is show the possibilities, the power of nonprofits and health foundations working together to create systems that are going to create great change. And I'll tell you, one of the things that we are fighting against, and I didn't want to put Kevin on the spot, he's a good friend, and ask him how the discussions are going in terms of the federal, when we're talking about raising the standards, are we talking about raising the reimbursement rate as well? And while we're doing this incredible food and employing men and women that are saving our communities money every day, again, most of the people that we're employing were in prison or homeless, okay? In DC, 73% of the people that get out of prison will reoffend and go back to jail in a year. And you know what? Their kids are going to end up in jail too. We see it every day down at DC Central Kitchen. The men and women who graduate from our program over the last 3 years, 2.5% recidivism rate. That's a savings right there of $2 million. Forget about the wages that they're earning when they're providing these meals, these healthy meals for the kids, and how that's going to affect their income, their performance, their family's performance. And now these graduates are keeping their kids in school. They're out of supportive housing. They're buying clothes. They're paying rent. They're making our community a better, safer place every single day. So I guess my little pitch is that as we continue to face these issues and try to come up with creative solutions, there's no question that the nonprofit sector needs to work with the foundation, or the social service side of the nonprofit sector needs to work with the foundation side of the social service sector to fill this gap. Because even though we're doing this work and we're getting a little bit more than the federal reimbursement, we're still losing money. Not much, but a little. And it's enough that we have to ask ourselves all the time, or our board of directors have to ask me all the time, Mike, can we really keep doing this? And when I look at all these bottom lines, the money that we're saving, the money that we're putting into the communities, the systemic generational change in expectations and outcomes that these programs provide, we absolutely have to continue to do this. And we want to continue to do this, to model this, and to show, again, the power of local food, healthy food, creative thinking, working together in our communities, nonprofits, foundations, the government together, that we can make incredible change.